Well, thank you, everyone, and welcome. Thank you for joining us today. I am Mandy Seataller, current chair of the National Child Passenger Safety Board and the Alaska Child Passenger Safety Coordinator. It's my honor to serve you as the MC for today's CPS Coordinators Forum. Remember to put where you're from in the chat bar. We'd love to hear from you. And we have a lot of time planned for questions in this format. So please put your questions in the chat bar. I'll be capturing those so that we can have a good discussion at the end of the presentation. As a reminder, please do not participate in this forum if you are operating a motor vehicle. We are recording this session and it'll be available in a couple of days at cpsboard.org.
Okay.
So please remember to mute your video or your audio. There we go. Our speaker today is Bekah Thomas. Bekah became the Director of Injury Prevention and Control at the Massachusetts Department of Public Health in 2017. There, she oversees the department's work on transportation safety, older adult falls prevention, child fatality review, sports concussion management, traumatic brain injury, spinal cord injury, and more. Prior to joining DPH, Bekah earned a master's in public administration from Millbury Institute of International Studies at Monterey and a Bachelor of Arts in the Intercultural Communications from American University. In her career, Bekah has worked to prevent injuries using a public health lens on 4 continents for a variety of governmental and non-governmental organizations. Welcome, Bekah. We're so glad you could join us today.
Hey, Mandy, thank you so much for having me. It's really exciting to be here, and especially looking through this participant list, I actually recognize some names here. Previously, I worked for the Children's Safety Network, and I think some of you participated in our Child Safety Learning Collaborative back in the day. So thanks so much. It's great to see these familiar names and faces. And thank you so much, Mandy Summers here in Massachusetts, for thinking of us. So we are going to talk a bit about employer education today, or employer buy-in for CPS programs. But I also wanted to take this bird in hand opportunity to learn from you. So while I hope that you'll take away a couple lessons from a toolkit that we're developing, I mostly want to get your input and learn from your expertise about how we can create sustainable child passenger safety programs, especially here in Massachusetts. And the content for the toolkit that I'm going to present today will be available, where we want to get your input before we move into the final formatting and approval of the document, but we'll share it around to this forum afterwards. And if anyone in your state or your organization wants to pick it up and modify it and change it for your own programs and services, we'd love to have you do that. We definitely want to share seamlessly and collaboratively. So I do hope you'll use the chat today. I hope you'll use the hand raise feature if you have a question. Really want to hear from you. So I'll do my best to keep this as interactive as possible. And with that, let me start sharing my screen. Okay. All right. So here in Massachusetts, we have been working for a little while now on what we're calling the Promoting Child Passenger Safety, a toolkit for pre-hospital providers. And it's a document that we're really gearing towards pre-hospital providers like fire and ambulance services, since they're such a critical piece of the CPS puzzle around the country. So on your screen, you should have those little emoticons like the hand raise feature and that sort of thing. Could you give me a little hand raise if you are from a fire or ambulance service? All right, I'm not seeing any hands come through, but that's okay. I think that the information in this toolkit will still be really relevant to you all. Just a caveat too, that the toolkit that we're working on, it does not address the safe transportation of children and infants in ambulances or other emergency vehicles. We know that that's often when we talk to pre-hospital providers, that's what they most want to talk about, but we're actually talking about CPS programs. So Our toolkit is structured around the following topics with child passenger safety injuries numbers, so some statistics around what we see in child passenger injuries here in Massachusetts, and then talking about determining organizational capacity and community needs for establishing a CPS program, the kinds of support services that CPS programs can provide to caregivers, some event planning, logistics, and operations of the program sustainability, which is the main focus for today, and resources and further reading, which I know that you all are the pros and the experts in that. So we're not going to dive into it too deeply, but if you do have things that you think are really critical for us to include, we definitely want to hear from you. So this, I know that I think there's only one other person, Mandy here, Mandy Summers here from Massachusetts today. So this isn't particularly relevant to you all, but I just wanted to share with you in case these are figures or information that you would want to seek from your own Department of Public Health in whichever state you're from, or if these are data that would be interesting to you, and also to frame it up a little bit about how we're talking about racial equity and child passenger safety here in Massachusetts. So our rate of non-fatal injuries among children ages 0 to 7 is 361.9 per 100,000. And in a 4-year period, we had 4,000 transports to the hospital for a child passenger safety injury or child passenger injury. And that was about 1,800 emergency department and hospital treatments annually for child passengers. And we know that nationally, about over a third of children under the age of 12 who die in a car crash are not properly restrained. And then when we look at our data here in Massachusetts, the rate of child passenger injuries is 4 times higher for Black non-Hispanic children ages 0 to 7 than white non-Hispanic children. So these are incredible disparities that we see in child passenger injuries in Massachusetts. This is a map of Massachusetts with the rates of child passenger injuries by county. You can see Hampden County over here. That's where Springfield, Massachusetts is. We have a really high rate of child passenger injuries in that county. But the thing is that geography and race and ethnicities, they don't need to be inherently putting someone at risk for sustaining a child passenger injury. So we wanted to frame it up and make sure that we're talking about the racial equity and geographic disparities that we're seeing in terms of social determinants of health and what's going on leading up to a crash. So we know that folks who have economic instability often are limited in their options for what kind of child passenger seat they can afford, and they often have to deprioritize child passenger safety in order to prioritize food or housing or other means. We also know that there's a lot of areas across the country that were divested from, so they didn't get the proper investments for their road infrastructure, and that's led to a lot of poor road infrastructure. Same thing with limited access to supportive services. There's a site out there called the Child Opportunity Index, and a lot of times where we see a bad crash outcomes, we also see low opportunity scores. And then, it's complicated. You all have a very important role in helping folks navigate what kind of car seat to choose, how to get it installed appropriately, when to size up or age up for the seats. And then there's also this physical challenge of actually getting in the car seat. I have a 2.5-year-old and a 6-year-old. They're both still in car seats, I promise. And man, installing that car seat is hard. I'm fairly physically fit, and it's still a challenge for me. I cannot tighten that thing appropriately. So if you think about people with more concerning disabilities or physical limitations, actually getting that car seat installed the right way is a big barrier. And then there's also limited awareness about the safest way to restrain children in motor vehicles. There's definitely a lot of conflicting information and confusing information out there. I know that I'm constantly talking to people about not putting kids in coats in car seats, and that is just something that hasn't gotten around enough to folks. So there's a lot of factors that contribute to the inequities that we see in child passenger injury data. So do you all in your own states, do you look at these kinds of data? Are you stratifying child passenger injuries by race and ethnicity or other demographic characteristics to learn a little bit more about who's at highest risk in your state? Hi, Jason. Oh. All right, I'm not seeing anything in the chat, but I would love to hear from you if you're also stratifying, or if you want to take some of these ideas and bring them to your Department of Public Health or any other area to get these data. I think it's really important to really dig in deeply on those data to figure out who you should be focusing your attention on the most. All right, so determining organizational capacity and community needs. I definitely want to hear from you all on this one, because we have some tips and tricks, and Mandy's been an excellent resource in helping us develop this toolkit and review the information, but we want to hear from you. So how we organized our toolkit is around 3 essentially levels of service that CPS programs can provide. And we kind of delineated these because in Massachusetts, it may be that some fire ambulance services have the ability to run an educational program, but they don't have the capacity to do installation and inspection. And we wanted them to have the tools and resources to provide that education, even if they didn't have the capacity to do inspections, installation, or car seat distribution. So we separated it into education, installation and inspection, and car seat distribution. Would you say this is a fairly adequate representation of the levels of service that could be provided through a child passenger safety program? Is there anything you would add? Thank you, Tracy. Good. I'm glad those 3 seem adequate. And if you think of anything else that you think should be added in, we'd love to hear your thoughts on that. So then yes. Oh, Denise, I can talk a little bit about how we access the child-related crash data in our state. We don't have a data dashboard. I work at the Department of Public Health, and I'm the Injury Prevention and Control Director. So we have a team of epidemiologists who look at our vital statistics, that's death data, as well as our case mix data, which is our hospitalization and emergency department visits. And we're very fortunate that we have someone who is very well versed in motor vehicle crash data. So she was able to pull and stratify these data for us using those data sets. And if you want to learn more, I'd be happy to share some more information. There should be in every state someone who can pull the vital statistics and the hospitalization data. Okay, so I'm curious, in your CPS programs, have you run any determination of needs or capacity assessments with your communities? Like, have you done any landscape assessments or a look around at what kind of organizations are already providing services, what the needs are of caregivers in the area, or specific populations like neighborhoods or specific cultural or linguistic backgrounds that are in greater need than others? Have you run that kind of an assessment? Somewhat. Erica, did you use a tool for your somewhat? Did you have any kind of guidance or tool for conducting that landscape assessment or looking around at community needs or existing infrastructure and capacity? Yeah, Aubrey, I totally hear you that try to have it for each county, but it's limited. But even thinking about when, so how do you do that? Is there like a statewide perspective, or we utilized online surveying from events and observational studies. Great. And whoops. Amy says it pulled several data points to determine which counties had at high risk populations, to determine such as below poverty level, English as a second language, no high school diploma, number of Head Starts, Hispanic population, etc. Great. So it sounds like maybe you had a list, an idea of who's at highest risk and what kind of risks to look for, and then did that, but you didn't have like a formal tool or a resource. Basically what I'm looking for in this toolkit is if there's an existing resource that we could point people to. Great. Thank you. Is there, on this needs assessment for a county, is there anything else that you would want to add to this list? Yeah, sounds like an add-on to this toolkit. Maybe we need to someday come up with a needs assessment that we can hand to CPS providers to look at in their community. Okay, the other thing that we guide folks to look at in their own organization is their organizational capacity. So how much staff time can actually be dedicated to child passenger safety services? Is there the physical space to provide on-site education or on-site inspection and installation services, or even a place where car seats could be distributed? Do they have the capacity to promote services, or will they need to coordinate or collaborate with someone to get the word out about services? Because that's one of the things that we find often, at least here in Massachusetts, is there are CPS providers, but families and caregivers don't necessarily know how to access it. And then, is there a budget to support this kind of work? Because especially if you're going to be running a car seat distribution program, that budget's going to be very important. And then, will staff receive overtime pay for services provided? And again, with the context of this being in a fire or ambulance service, where they have additional duties beyond their child passenger safety work. Anything else that you would say would be a key consideration for organizational capacity when they're setting up a child passenger safety program?
About the campaign level.
Oh, Jason, yes. We actually have that on a future slide. In the specific, I'll get there in a moment because I don't want to like make you dizzy by me scrolling through all of these different slides. But Jason, do you have a policy for car seat distribution? We're looking for a sample policy and couldn't find one online. Health departments seem to be an ideal venue. So maybe a piece about considering who to partner with. Yeah, in Massachusetts, it's complicated. We have, even though we're about 2% of the US population, we have 13% of the health departments in the United States because every city and town has their own health department. We are very decentralized in Massachusetts, and it makes it a little bit hard to coordinate and collaborate with them, also because their mandate is so huge. But that's a great idea too. Well, Jason, if you're willing to send me one of those local car seat distribution policies, I would love to see it. And same with you, Erica. It's okay. It doesn't need to be perfect. We just, want to kind of sample. And if you have thoughts about what kind of edits need to be made, we can make a mock policy. It's just really, since this is a toolkit, we want to provide really practical, tangible resources for folks. All right. Oh, thank you, Jessica. Yes, I will take Michigan's. I will take all of your policies. Send them all to me. Thank you, thank you, thank you, thank you. That's why I'm here. I need y'all to have all the answers. So the next section of the toolkit, we talk about providing CPS support for parents and caregivers in terms of education. So the next 3 sections will focus on education, and then installation and inspection, and then car seat distribution. And in the car seat distribution piece, we talk about the policy a little bit. So in the education component, we talk about some of the different formats that could or should be considered by the CPS program, like live demonstrations, print materials, videos, and language and cultural communications. And then we provide some resources about information for families and the CPS technician guide, Safety in Seconds app. Massachusetts has a translation toolkit, so we'll provide that as well. And then the Safe Kids Worldwide community education and outreach tips. And then this education section of the toolkit also dives into some topics that we thought were really critically important to make sure that are included in a child passenger safety program. and again, we focus this on Massachusetts. So a little bit of an overview of what the Massachusetts child restraint laws are, so that providers can educate parents and caregivers about what those laws are and what the expectations are, with a link to additional information to learn more about the law. A little bit on selecting a car seat or a booster seat so that we can provide those information to families. Some on financial assistance for purchasing a car seat, which is fairly limited here in Massachusetts. You know, we direct people to Mandy, but also we have direct people to their insurance programs, and there are a few hospitals that provide car seats as well. Proper car seat use and maintenance, the importance of correct car seat installation. We have a bit on parents and caregivers as role models, talking about how it's important for a caregiver to use a safety belt if you want children to continue using a safety belt past their booster seat age. We also provide information on car seat recalls, what to do, when to change a car seat, or about car seat expiration dates, used car seats and safety, heat stroke, so what happens if you leave a child in a hot car, and backovers. What do you think? Is this a decently comprehensive list of the education points that we should be providing? I think I didn't see it on this list, but we definitely have it in the toolkit, is also talking about, you know, with the proper use of a car seat, making sure that that kids don't have their coats on in the car seat, etc. Oh, thank you, Erica. Sounds like it's fairly comprehensive. Oh, thank you. Oh, great. All right. Well, if you think of additional items that we should be cleaning car seats. Yes, Denise, we have cleaning car seats in maintenance, which is a little bit clearer in the toolkit. I didn't want to overwhelm you all with all of the text that's also in the toolkit. Oh, and Amy, steal away. Oh, reporting defects. That's a great idea, Tracy. We can definitely add that in. And thank you for that resource, Aubrey, on the free online training on car seat basics. Great. We'll definitely add that in too. Flying with children. Tell me more, Denise. And yes, Mandy, I can show you the translation toolkit for sure. Oh, whether and how to use car seats on planes. Interesting. Do you know, are there any resources out there that we could learn from? Yeah, it's not really roadway related, but it's, you know, it's connected. And even, you know, I've had friends contact me recently saying they need to rent a car. Can they borrow my car seat when they're coming to Massachusetts? And so talking about renting cars and renting car seats as well might be one thing. Yes. And the vehicle and car seat recalls, we do provide the recall link from NHTSA. Check to protect vehicle recalls. Okay, we'll include that one as well. All right. Oh, and FAA.gov has guidelines for flying with car seats. Great. Excellent. So I'm so glad this is being recorded so that we can capture this all later too. Thank you. All right, moving on to inspection and installation. Final thoughts on education? Anything on the previous section that you want to make sure you get on our radar? And you can follow up with us afterwards too. Okay. Inspection and installation. So we bucketed this out into 3 types of inspection stations: permanent inspection stations, mobile inspection stations, and virtual or remote inspections. And in Massachusetts, we're not really encouraging remote inspections just yet. So I think that's really correct, Mandy. Oh, great. There's so many more resources coming in for the education component. That's wonderful. We'll definitely check those out. But looking at these 3 buckets of inspection stations, did we get it? Or is there anything that you would want to change or modify about this? Okay. Sounds good. And then we talk a little bit in the toolkit about the benefits and challenges of the 3 types of inspection stations. So what are the benefits and the challenges of a permanent inspection station? You know, with permanent inspection stations, you have to have that space, that permanent location, which can be a challenge, but it does allow for higher capacity and more set schedules. Denise asks, do we distinguish events separately? Are those considered mobile? Yeah, I think we would consider it mobile. So like going to a fair or setting up a separate event for an installation and inspection, we do consider that mobile, and we can work on the definition there to make sure that it works. Like event versus inspection station. Yeah, an inspection event, we would consider that. This is how we, this is kind of how we define it, with a permanent inspection station being a stationary location with walk-in or scheduled appointments available, and a mobile inspection station being a van, a trailer, or other large vehicles that can be used to carry necessary equipment and meet caregivers where they are, like setting up at a park on a Saturday or some such thing. Does that help? Great. Yes. All right, great. And Bill has a great reminder in the chat to always check the NHTSA CPS locator site to make sure all your info is up to date. We will definitely reference that too, so please do. So again, these are the benefits and challenges that we have for each of these different types of inspection stations or events. We'd love to hear your feedback if you think that this is basically a way as a pre-hospital provider, a fire or ambulance service, and really anybody else who's going to set up a CPS program can start to think about, like, what kind of services do they want to run? How do they want to set it up? What are they capable of running? And what are the benefits and the challenges of setting it up and running it that way? So if you have other considerations for us, we would love to hear from you. All right. So, and then there's, we referenced heavily the NHTSA CPS technician guide for interacting with caregivers for some tips about educating caregivers on car seat installation. And again, looking for feedback on that. I think that this one, since it's such a well-known and well-used resource from NHTSA, I think that they probably hit the nail on the head. So I think we're in good standing on this one too, but we'd love to hear from you. All right, and then car seat distribution. So this one is actually the shortest section of the toolkit because we didn't have a whole lot to say here. We talk about the challenges and considerations that a provider should take into account, like how impactful this kind of an approach is when you consider the financial hardships and the difficulty that some families may have in purchasing or replacing a car seat. And then we also talk about the need to develop a policy that considers who's eligible for free or discounted car seat, how the car seat will be purchased, keeping in mind that car seats expire, so you can't buy a big bulk of car seats unless you know that they're all going to be distributed right away. And then record keeping about purchases and distribution. And when we get your policies, we'll definitely revise this session or a section and make sure that we reflect the pieces in your policies too. But what did we miss in this policy section? Nothing? All right, I'll take it. Oh, great. The digital car seat check form has the ability to track distribution of seats. That's great to hear. Awesome. Well, we require in-classroom education prior to distributing a car seat. That's a great consideration. It really ties in that education piece. how will education be provided for each distributed car seat? So that's, yeah, tying in with Aubrey's. Seems like Denise and Aubrey are really on the same page about that. Great. All right. Okay, well, if you think of other considerations for us, pop them on into that chat. And for Massachusetts, these are the resources that we've listed for helping families and caregivers get a car seat. So these are the local hospitals that we know distribute car seats, though it tends to be for their own clients. The Massachusetts CPS program, thank you, Mandy Summers. Insurance companies, we know that Mass Health, which is basically our Medicaid program here in Massachusetts, they do give one car seat per child under the insurance policy. But it gets really tricky once the kid ages out of that car seat or sizes out of the car seat. And depending on what happens to, like if they're in a crash, we're not super clear on getting a replacement car seat because that tends to fall more under the automobile insurance and not the health insurance. And Mandy, let us know if you have any corrections on the Massachusetts front. And then the next section, rather than talking about event planning, logistics, and operations of the CPS program by the 3 types. Ooh, Mandy has a hospital to add. That's music to my ears. Rather than breaking it out for event planning, logistics, and operations for education, installation, and inspection or distribution, we kind of lumped them all together for this section because we thought that there were a lot of overarching themes that could be pulled in. So we talk about staffing. You all know plenty about staffing. So let's not dive into this too deeply, but we did pull from a number of national resources for this, for all of the various roles that need to be considered in these events. We talk about finding a certified technician partner. Even though Massachusetts is a small state, we still have rural zones and areas that have fewer CPS technicians. So we talk about how to partner with that. And then we talk about the kinds of supplies that are needed for running a child passenger safety program, and what people should have on site for running the program. And then we have some tips and tricks for promoting the event or service. So tips for choosing locations, sharing information, and print flyers. And then we do give some ideas in the toolkit itself about the types of organizations that can provide partnerships. We do include local public health, local boards of health here in Massachusetts for those tips as well. All right. Now, this is the part that I know the coordinators of this forum were interested in me talking to you about the most. So, and I think this one might be fairly Massachusetts specific for some of the work, but also would love to hear your lessons learned, because we know that it's not enough to just get one person to be a certified technician and then the program's going to be up and running for infinity. It really takes a lot of concerted effort to make sure that these efforts get baked into a system, baked into an organization, so that the continuity of the program is there. So we say that in order to get continuity of the program, you need to establish a CPS program organizational structure and practices. So create and maintain job descriptions, program documentation, local guidance, or tip sheets for what works in the community. Identify and maintain updated tips and guidance for CPS technicians, in this case, especially emergency medical services. Assign a CPS inspector coordinator role within the organization. And this is the Massachusetts specific component, apply for community EMS certification. So community EMS, or CEMS, is a program that we offer here in Massachusetts for pre-hospital providers like fire and ambulance services that provide community EMS. It's a community-based program. They can do all sorts of different topics. Child passenger safety is one of the topics, but they can also do blood pressure checks and older adult falls checks and lots of other chronic and injury-related topics where pre-hospital providers are considered just a resource where they can go into people's homes, get them connected to services and programs, and support prevention that way. It's a fairly inexpensive application. I think it's $25. And it's really to give credit to the pre-hospital providers who are already doing this kind of work in their communities. So Massachusetts specific, but it might be worth a look to see if you have partners in your jurisdictions that are also running these types of programs. They make excellent partners. And then making sure that agency leaders prioritize continuing CPS program efforts. So identifying a budget or a funding stream for costs for discounted or free car seats, providing pamphlets and resources, updating or repairing technology, or using public facilities. We at DPH, we are planning to provide some technical assistance about child passenger safety and available resources. And we'll work really closely with Mandy on that. Considering partnering with local health departments, law enforcement, fire departments, and other organizations in the area. Also, contacting vehicle manufacturers. I imagine in Michigan, this would be a good one too. So if you work with those OEMs, those original manufacturers and insurance companies, oftentimes they have funding available, or it's a great PR opportunity for them. And if your agency is allowed to accept donations, figuring out a way to capture those. All right. What would you say? What have been some of your lessons learned in creating continuity of the program or buy-in for the program? Oh, Sassy, I just see your comment now about suggestions on where one might apply for grants and funding for the purchase of child restraints. Yes, and we do have the Massachusetts Traffic Safety Grants link here too, but maybe we should put that in another place in the toolkit as well. Offering continuing education opportunities is big for keeping our technicians certified. That's great. Thanks, Aubrey. Wonderful. I think making the case with data could go a long ways too. Sometimes when you get that vocal partner or advocate within an organization, they can get that leadership buy-in by showing the data on how big a need this is. Buy-in from the top, definitely. Sometimes you get that buy-in from the top through the data, and also showing that, if you do this work now, this upstream prevention work, then you have less work downstream. Ceci says, partner with the highway office and law enforcement for sure. Denise says, NDCF is really helpful for making the data case. The data dashboard is great. Awesome. We'll definitely check that out. Thanks, Denise. All right, if CPSTs are paid by agency, allow for recertification activities to be part of their paid employment. That's great, Jason. We'll totally incorporate that for sure. Cool. This is really helpful. I'm so glad that you all let me come into this. All right, that's the bulk of our toolkit. The toolkit itself has a lot more words in it than this PowerPoint presentation, but basically all the content is there. The last slides that we have are resource slides, just about the certification resources and programs, the management resources, program management resources continued. There's a lot of them out there. Educational resources. And that's it. So I know I flipped through those ones really quickly, but if you do have additional resources or information that you think would be really helpful to someone who's just trying to establish a child passenger safety program for the first time, I think this would be really helpful. Okay, what do you think about the contents of the toolkit? What did we miss overall?
Becca, this is Mandy Seataller. I'm wondering if you'd be okay if the participants unmuted themselves if they wanted to ask a question. Is that all right with you?
Absolutely, please.
Maybe we can engage in a little more conversation. Looks like you've got a couple in the chat bar. Would you like to read them or do you want me to provide them to you? What works best for you?
I think I can read them. So I saw Amy saying that she loves it. Thank you so much. That's great. Denise has a question. Do any of your pre-hospital partners offer a blind zone identification service and add on to the car seat checkups that helps vehicles owner understand the limitations of their vehicle's line of sight? I have no idea. That sounds amazing. I know I've seen the research out of New York where a lot of the pedestrian fatalities that they had were because of that, the structure of the vehicle and the blind spot that was created on the front of the car when people are turning into onto another street. They get the blind spot from the I don't know what they're called, but basically the structure around the windshield. I have no idea. I would love to look into that. If you have any resources for that, I think we can populate that into the educational components, that table that we have of different things to educate providers on. I think that'd be really interesting to include. There's my email address, Amy. And thank Alexandria is on our team and she's here helping me take notes today. I think our another colleague, Ainsley Chinecko, is also here. They are the true brains behind the operation here. I just get to be on the screen with you all today. But thank you, Alexandria and Ainsley, for all of your amazing work on this. Yeah. Denise, I have to say, absolutely, you know, maybe another thing that we want to include in there. I'm the co-chair of the Child Fatality Review Program in the state, so I get to hear all of the really terrible stories, including the child passenger and pedestrian stories, and driveway backovers and runovers are definitely something that I want to make sure are included in there. Kidsincars.org has a testing kit for those blind zones. Awesome. Thank you, thank you, thank you. Oh. Julie says they're going to recruit fitting stations to participate as car fit pilot locations. Yes, and we do have some resources on heat stroke prevention education in the education table. Yeah, I think that Denise, I think you're totally right about the blind spot assessment. That makes a lot of, especially since we don't have a lot of entry points for that, and it's such a little known barrier or risk for pedestrians. And we've certainly been seeing an increase in pedestrian fatalities in Massachusetts over the past 2 years. So we will definitely look into that some more. Thank you so much. Great.
Becca, Mandy again. You know, it's not quite child passenger safety related, but we've done a little bit of work with car fit for older adults so that they can fit their seatbelts. And we've thought about kind of partnering that with our CPS program and making sure the adult is riding safely as well. And that's a way to increase overall occupant protection for all members.
That's great. Yes, we'll look into the car fit because there is that piece in the education table about using a car seat as a care provider as well, and the importance of that role modeling. So we can definitely include that in there. And I know we looked into it in the past about or in my previous role, I looked into, I think, a similar thing to car fit for pregnant people who were thinking about how to use their seatbelt the best way. Great. Well, we have a lot of things to consider for inclusion in this car seat, in this toolkit, and rounding it out. I'm very grateful for the positive feedback. I was a little afraid that you all were going to tell me that we missed a lot of things, but we have a great team, so I know we didn't miss that many things. We're definitely going to round it out. We're going to format it. We'll have it available in a plain text version as well as a nicely formatted version, and we can get it out to you once it's complete. Our approval process is very lengthy, so you might not hear from me for a little while, but we will definitely make sure to get it back out to you. And then if you want to adapt it to your own program or service or state or whatnot, we would love to have you do so.
Thank you, Becca. I don't know about everybody else, but my head was just spinning. It's like, oh, I love to see all this information succinct and all these points we should be thinking about as we're writing new grants and trying to figure out how is work going to continue now, and what can we do to improve it. So yeah, madly scrambling about, oh, what can I do now? So thank you. This has been great.
Oh, my pleasure. And I want to give, since I saw that there were a few people here from Indiana, I wanted to give Indiana a shout out, because a lot of the inspiration that I have on child passenger safety came out of some work that Indiana did in that child passenger safety learning collaborative that I talked about in the beginning. And then I also wanted to just give a shout out to Conrad, because I think it's like 4:30 in the morning in the Northern Mariana Islands, 4:47 in the morning. So kudos for being on this call. So great to have Northern Mariana Islands represented here. Mandy wants to see the translation tool, or Mandy Summers wants to see the translation tool.
There's two Mandys with an I. It's kind of awesome.
It is awesome. I was like, oh, I think this might be a requirement for to be a CPS tech. Okay, MDPH's translation toolkit. Oh, come on, of course the link is not working. Right, let me try it a different way. All right, we're in action. I'm not super familiar with this resource, so you'll have to forgive me. But this is the translation toolkit for the Massachusetts Department of Public Health. It walks through, we have a lot of regulations and laws in Massachusetts about what languages we should provide information in, and making sure that information is accessible. So this looks like it has the foreign language guide, translation guidelines, a translation request worksheet, translation checklist, quality assurance, and in-house translation. So I'll pop this into the chat as well. And I'm betting there's other states that have similar resources too, but it talks about what the most common or popular languages are in Massachusetts, resources for interpreter services. Interestingly, one of my graduate professors was from Massachusetts and did some really amazing research about when translation services are provided in healthcare settings, non-English speakers actually get better healthcare than English speakers, because they basically not just only have a translator, but someone to help navigate the system and interpret the information. Okay. So let me pop this into the chat for everybody, and Mandy, you can check it out when you want to as well. Oh, one of our grantees is the refugee center. That's great. All right, I'm going to pull this down because I don't think that I'm very well adept at running through this, but I definitely think it's a useful tool that's out there. And I know that our Office of Health Equity here at DPH, who owns this resource, is very interested in promoting equity, no matter where people are, and would be a very helpful resource in this work. So I'll stop sharing. Great. All right. Any other questions or thoughts for for our team here in Massachusetts.
Wow, Becca, this has been some really, really amazing information. Thank you so much for sharing. I'm looking forward to the end result of this. Sounds like it's going to be a little bit of time, but we would really love to follow up and be able to provide that information to our CPS coordinators so they can use or share in their state when the time comes. Any final questions in the chat box? I'm with you, Denise, on the cool translation tool. I already downloaded it. All right, Becca, could you throw up that last, oh, I've actually got a couple of reminders. So Jessica, I need you to put those up, but I wanna make sure, why don't you put your contact information in the chat bar to make sure people can reach out to you if they'd like to. And Jessica, if you could share the PowerPoint. Couple more slides. I want to just share the upcoming CEU webinars we have available for technicians. Make sure you register early. Jessica with NSC on the call right now is going to be presenting on April 19th, and Denise Donaldson, also on the call with us today, is going to be presenting on May 24th. These are going to be really incredible webinars. They will be recorded and posted, but if you'd like to see the live version, please make sure you sign up soon. Next slide. We also have some upcoming webinars for the CPS Coordinators Forum. If you have topics that you would like to discuss, please reach out to us. If you have speakers you'd like to recommend, please reach out. We want to talk about what you are here to talk about today. You can enter it in the chat box now, or you can email secretariat@cpsboard.org. Oh, good. I'm glad you're excited about May. I think we've got some really, really amazing opportunities coming up. So thank you all for joining us today. We are so glad that you were here. This Coordinators Forum recording will be posted to cpsboard.org/CPS Coordinators Forum within about 1 to 2 business days. Again, please reach out if we can do anything for you, and have a wonderful day. Thanks again, Becca. We're so glad you were here. Please end the recording.